The color is orange, steady as she goes. Local vaccination plan unveiled. 1 in 3 go against the grain. And Winter Blast extends Family Day weekend. I'm Roz Elliott, and I'm joined by co host Lizzie McDonald. And together, we are shining a light on Ontario's West Coast with your Local One News, hyper local for you. Lizzie, welcome to a snowy week.
Roz, thank you. And you're not wrong with that description. I think the snow is almost as tall as me.
That means it's even past me.
Yeah, exactly.
Well, let me tell you a little bit about where we stand on the COVID thing. This week, Huron-Perth Public Health Region returned to the orange restrict level in the provincial framework for managing COVID risk. And we exited, of course, the shutdown from the past 6 weeks. While the orange restrict offers increased access, health authorities caution that we need to maintain a steady hand to avoid a spike, especially with the new, more transmissible variants now in the province. This means to stay at home as much as possible, avoid social gatherings, limit close contact to your household only, and work from home if possible, and avoid travel except for essential reasons. The general measures remain the same, with social gatherings now at 10 people inside and 25 outside, face coverings required in indoor workplaces and public places, and restricted travel from areas of high transmission to areas of lower transmission. Neighboring Grey Bruce moves to yellow protect, and Middlesex London enters the red control. Lambton also moves to the orange restrict. As we look at here in Perth, we currently stand at 34 active cases with 49 deaths. Lizzie, that's where we stand as of now. And I guess the takeaway is just because we can doesn't mean we should.
Yeah, absolutely, Roz. We are very lucky to have these kinds of restrictions changed in our region, but it absolutely does not mean that we stop caring.
Yeah, there's still much we have to do from a steadiness hand. Now, tell us, there is good news and it is rolling out. Talk to us about vaccination.
Yeah, absolutely. The Huron Perth Public Health has also unveiled its regional vaccination plan founded on the 3 M's by Dr. Miriam Klassen. And we've actually got the clip for you guys to see what she has to say about them. Let's check it out.
In terms of vaccine update, this week we're continuing to give second doses to residents of long-term care homes and high-risk retirement homes. We're on track to complete those, I believe, February 18th. We were a little bit sidelined by some weather, but that's not new for us in Huron-Perth. So, it just changed our plans a little bit, but we're back on track. Staff, residents, and essential caregivers of these facilities remain the priority population, and the province will continue to provide direction on who receives the next doses of vaccine that arrive. Huron-Perth Public Health has released the Huron-Perth COVID-19 Vaccine Implementation Plan Overview based on the model of bringing vaccines to people. We are a large geographic area with small populations distributed throughout, and we're committed to providing vaccinations equitably across Huron-Perth for everyone who wants to be vaccinated and want to remove as many barriers as possible. Given these factors, the model that has made the most sense was to bring vaccines to people instead of people to vaccines. The Huron-Perth model will rely on 3 M's, mass vaccination clinics, mobile clinics, and multiple sites and partners. Multiple sites across both counties will ensure geographic reach. Tentative hub locations at this time are Ringham, Clinton, Goderich, Exeter, Listowel, Stratford, St. Mary's, Milverton, Mitchell, and Seaforth. These locations also align with primary care partners who are prepared to provide support. And we are prepared to scale up vaccinations by activating more clinics and extending hours if supplies increase. The goal of Huron-Perth Public Health and our partners is to vaccinate at least 75% of the eligible population in Huron-Perth as quickly and safely as possible. All vaccines will be administered in accordance with provincial guidance and the provincial ethical framework. And you can visit hpph.ca/vaccines to see the plan overview and learn more.
So, Roz, I think the way that Miriam has explained that was perfect, absolutely perfect with the 3 M's. Don't you agree?
I do. And just again, the 3 M's, what did it start with?
So we began with mass vaccination clinics.
So that's just, again, a lot of people getting to a clinic, and then the mobile clinic. So the vaccine comes to you, not you go to the vaccine.
Yep, exactly. And then our third one was multiple sites and partners. So having those many resources for people and connections for them to be able to access it.
And that is just a true blue in the area. The public health really works well with all the organizations locally. And that has been sort of a focal point throughout the whole pandemic, just the collaborative effort amongst us in the area. So again, the vaccination plan rolling out right now. Lizzie, what else do you have for us on the COVID front?
Well, speaking of keeping everybody with their role in the area as well, we have the report of 1/3 of Huron-Perth retailers are revealed to be non-compliant with the province's workplace safety requirements. The province conducted a workplace safety campaign between February 2nd and February 4th in the region covered by Huron-Perth Public Health, including Stratford, St. Mary's, Exeter, and Clinton. The team of officers visited 137 essential businesses and found that approximately 2/3 were in compliance with the requirements under the Reopening Ontario Act. 7 tickets were issued locally, as well as 9 occupational health and safety orders. The most common oversight from these: businesses had failed to develop a COVID workplace safety plan that was available to anyone and is posted in a place that can be easily seen. Such a plan details the measures and controls in place for that business. Other non-compliance failures also included inadequate screening of employees and patrons and not observing capacity limits. And for our viewers, Fopop Media has its COVID-19 workplace policy developed and posted with screening and capacity measures in place. And for the time being, we continue to broadcast from the safety of our homes, which, yeah, we absolutely do. We want to make sure that people know that we are putting in the effort that everybody needs to be putting in. And it's really important to keep an eye on these kinds of roles that everyone needs to fulfill.
Yeah, it's definitely, I hear the phrase in my head over and over again, steady as she goes. It's a tenuous line, and we will continue to broadcast from our homes. We'd love to be in the studio, but certainly nicer setup. But right now we know we can and we will continue in this vein. Well, another reason, Lizzie, not to go out is this incredible snow blitz that hit us this week. Family Day just became an extended family weekend with school closures extending across Midwestern Ontario. And for many, the dumping meant a double or maybe even triple effort to clear walkways and driveways. And I wanted to share with you, my friend, that my 100-foot driveway, I was helped out by the men of Fawn Creek Lane, Jason and Brad, who plowed and shoveled our way to freedom. Brad in his Bobcat and Jason with his trusty shovel. And I'm thinking of having a calendar made, Lizzie, of the men who plow. What do you think of that?
I think that's a great idea, Roz.
Well, I think we should give a shout out to all the good neighbors out there and the Samaritans who lend a helping hand to seniors and just to girls who live on Fawn Creek. And of course, let's acknowledge our snow plow operators who ensure our roads are safe. They go out in all hours, they go out in all conditions to make sure we can get to where we need to go. And another reason why we should stay put unless we really have to brave the roads. There's people out there doing some very important work, and the less we can be out there, the better for them.
Yeah, absolutely.
Well, let's take a break, Lizzie. And when we come back, we have several interviews we'd like to show our viewers, and very timely ones at that. Let's take a break and come right back.
Sounds good.